Dr. Suzanne, and today in this video I will go over what is carpal tunnel, the benefits of receiving acupuncture, and helpful stretches you can do at home. Carpal tunnel syndrome is a painful condition that occurs when the medial nerve in your wrist is affected. Often this nerve is affected when the palmar synovial tendon sheath is inflamed from activities such as repetitive strain injury or has compression due to swelling, which is often the case during pregnancy. The median nerve originates from the brachial plexus, which originates from the C5 to T1, and the ulnar and radial nerve also subdivide from the brachial plexus. However, it is only the median nerve that passes through the carpal tunnel, giving rise to carpal tunnel syndrome. In saying that, if injury occurs further up near the brachial plexus, you may also experience pain in the wrist and or hand, and the median nerve terminates in the first 3 fingers. The pain is characterized by both sharp and or dull, with tingling in the thumb, index and middle finger. And because other nerves may also be affected, you can sometimes feel these sensations in all your fingers as well as through your wrist and into the forearm. This syndrome will likely also decrease your grip strength and is common to feel worse at night. Fortunately, acupuncture has been shown to be highly effective at reducing pain associated with carpal tunnel. This is due to a variety of reasons, including acupuncture is able to stimulate your own natural painkillers, such as endorphins and cannabinoids, as well as clear excess fluid that may be compressing on the nerve. In one randomized controlled trial, efficacy of acupuncture versus night splinting for carpal tunnel syndrome, it was interesting to note that the pain significantly decreased in the acupuncture group, and that acupuncture was just as effective as the splinting group in reducing severity and functionality, which means they improve their grip strength. If you're experiencing carpal tunnel pain, there are a few exercises that may help reduce this sensation. Firstly, you want to start with a few warm-ups before we go into the full stretches. For the first warm-up, just make a loose fist with your hands. Keep your elbows bent and your wrists bent. You want to bend your wrists comfortably down. Just get a nice little stretch there and then comfortably up. Don't overstrain, it's just a nice gentle warm-up. You should feel a bit of a stretch in there. You can do this for about 30 seconds or longer if you wish. Basically, you want a nice continuous stretch back and forth, up and down, kind of like you're revving a motorbike. This helps to loosen up your wrists. Alright, now turn your thumbs upwards. I'm going to do the same, backwards and forwards, just stretching up and down, just loosening and warming up your wrists. This will be really good if you've got numbness and tingling down to your fingers. We just want to move in a nice continuous motion, not too fast, not too slow. Just want to get everything nice and loose in there. We're going to do this for about 30 seconds as well. Now we're going to go into your full stretches. So, for the wrist extenders and wrist flexors. So raise your arms up and you're going to go into your stop sign. Now if this is too much, you can just go into a loose fist. Back into our stop sign. Here you should feel a good stretch through the wrist flexors. But if you want more of a stretch, what you can do is you can gently pull back and get even more of a good stretch through there. You want to alternate this between the 2 hands. If you get too much numbness and tingling, just stop, shake it out and go back into your stretch. Now we're going to do the wrist extensors. So we're going to point our fingers down to the floor. Once again, you should feel a little bit of a stretch through here. If it's want more of a stretch, just curl your fingers under. If you want even more of a stretch, once again, you just like lightly pull back. You should feel a nice, good stretch, not a bad hurt through here. Okay? And basically you want to alternate between these 2, so your stop signs and your little fingers down. Do this about 3 times, 30 to 15 seconds each. Okay, so now we want to go into our prayer stretch. So put your hands together, put your palms together and your arms down, and then gently bring your hands down into a prayer. Now, if this is too much, because we are compressing on the median nerve, just bring your arms back up, gently upwards, and just bring off that tension. If you feel comfortable though, keep going down, and hold that for about 15 to 30 seconds as well. If you come back up and the tingling is still there, just shake it out. If it's still there, then stop your exercises because the problem could be coming further up in your neck and shoulder, and you probably should go see your GP or your acupuncturist to get that addressed. Now, even though the problem is in the carpal tunnel, the nerve pathway does go up through the shoulder up into the neck. So tight muscles up in the upper region can also be compressing on the nerve. So it's good to stretch out a few of those muscles as well. So firstly, we want to stretch out your pecs. So what you want to do is put your hands into a clasp behind your back. So clasping your hand behind your back. Now you want to pop your arms outwards and your chest out too. And you should feel a really good stretch all through the pecs through here. Hold that position for about 15 to 30 seconds as well. Once again, if you get a bit uncomfortable, just flick it out and start again. And lastly, we want to release the anterior scalene muscles through your neck. So to do that, what you want to do is hold onto your clavicle or onto your shoulder and turn your head to the side and then look upwards. So your ears should be pointing to the ceiling. And you should feel a nice, good stretch through the front of your neck here. Hold this position for about 5 to 10 seconds or until you feel comfortable. And slowly come back down to the center. Now, even though the pain may be on one side, it's a good idea to stretch out both sides so you feel even. So, we want to do the same for the other side. So hold down your shoulder or your clavicle, turn to the side, and look up. Very gently. If you've got a bit of neck pain, you want to be nice and smooth and gentle. Don't go too fast. And you should feel a nice stretch up through the front here. Hold that again for about 5 to 10 seconds and then slowly release. You can repeat that 3 times each side. Now, if you do these exercises and you do have numbness and tingling or burning sensation that won't go away, please stop and go see your GP or acupuncturist. So, if you like what I've talked about today, please like and subscribe, and I will see you guys soon. Thanks.